Thank you all for coming. My name is, as Tony said, my name is Danielle Cholminsky. I work here at the Center for Applied Strategic Learning at NDU, and I'm also a student at the George Washington University School of Public Health doing a master's in health policy. And just before I get started, how many of you came to the first one? Okay, a couple of you. Okay, no problem. I don't know if any of you watched it online. It was posted. That's all right. You can if you want to. That basically just I just did an overview of the entire healthcare system and how it works and why these reforms came about and what was the basis of it. But if you didn't, that's not a problem. But before we get started, also I just wanted to say that this is obviously a very political topic, and I know everyone here, whether you think you do or you don't, you have an opinion. I definitely want to hear those opinions. This is a not for attribution environment. My job is to just display the facts as much as possible and not I'll try to give a very fair and balanced opinion. Maybe wrong choice of words. So I'll try to be as politically neutral as possible. But if you guys have any opinions or you want to challenge me, please do at the end, because we do have a lot to get through, and it's a pretty large topic. So I want to get through as much as possible. So save any questions you have for the end. So before I get started, again, sorry. How many of you would say that you're confused about the healthcare reform? About half, you'd say. Well, you're not alone. 53% as of March 2011 said that they are also confused about the healthcare reform, and that's the number one word that most people use to describe their feelings towards it. So you're definitely not alone, and my job is to maybe clear some of those up, or maybe it'll be even more confusing when I'm done. So we'll see. So a couple things we want to do today. First, I want to just talk a little about the history and the politics behind Obamacare and how we got here. Then I'm going to go over the bill itself and then how we're going to pay for it, the Supreme Court decision, and some remaining issues and some of the GOP alternatives that have come up in the news recently. And then hopefully have some time for some question discussion and then some other resources that are a little bit more specific to your own personal needs. So how we got here. So many of you will probably remember, even if you weren't alive or you were during that, this is not the first time that the U.S. has tried to do a healthcare reform. Nixon, Carter, Clinton, most recently Clinton and others have all tried, and they've all failed in the past. Hillary Care was the most recent. And Obama had a lot of advisors saying this is not a good time to do it. You're in a recession right now. A large government program is not the best time. But he still said that healthcare costs are crippling the middle class and cutting a lot into corporate profit. So he wanted to do something about that, and it ended up being his signature policy of his first term, as you all know. He also felt that the stars kind of aligned in 2009. There was a Democrat in the White House, Democrat in Congress, both House and the Senate. So it was kind of the perfect time, and as him and his advisors saw. Not all of his advisors, though. Biden was very much against it, and because he saw it fail so many times, and it was very politically risky because if this was a huge initiative and it failed, it'd be detrimental politically for him. But he did have Rahm Emanuel, who was the senior advisor for Clinton during the Hillary Care in 1993, and he learned a lot from that, and he took that with him to the Obama administration. And he basically said, we've learned a couple things. One is do not write the bill for Congress, and that's what happened with Hillary Care, is that Hillary wrote the bill, gave it to Congress, and said, here, pass this, and that was not very well received in Congress. So we said, we need to step back. Obama should not be the main face of this initiative, at least not yet. And we should have Congress have the most buy-in, and they have the most control. The second was you need to move fast. The more momentum you have, the more chances there are. If it's a hot topic, then things move quicker. And that's what ended up happening. And the third, and I think most important, was he learned to neutralize the opposition. Is what happened with Hillary Care and a lot of the single-payer proposals that have come up in the past was that they really attacked the insurance companies, big pharmaceutical companies, and a lot of other medical institutions, which they're extremely powerful and have a lot of money, and lobbied very hard to kill it. And so his idea was to switch it on them and get them on board first so that you can go ahead and actually win people over. And so then he works a lot with special interests in industries as well. So the interesting thing about healthcare reform is that everyone was involved in it in some way or the other. There would be people lobbying from everywhere, from Roman Catholic bishops were lobbying against abortion funding, to pharmaceutical companies, advocacy groups, associations, lobbies, trade groups and trade associations, hospitals, insurers, businesses, large and small. Everyone from Walmart to a two-person business was involved in this in some way. So everyone had their hands in the pot. which is really what happened when he first started. Was in spring 2009. That's when all the industry deals really started. So Rahm Emanuel, as I said before, he said we need to get the industry on our side first. So he made him and Speaker Reid and Pelosi really went to the industries first and said, what can we do to get you on your side and to support this? And what they did was they first made a deal with the insurance companies, which basically said, we're going to give you 40 million new customers because of the individual mandate and by expanding the exchanges, which I'll talk about later. But in exchange for all these new customers, you have to either decrease premiums or they're doing all these new regulations, which I'll talk about in a second. So that was the deal to get them involved. And there was a lot of campaign contributions from the insurance companies to kill the public option because they saw that as their #1 competitor. The second deal that they made was with the pharmaceutical industries. And the deal was you need to lower costs for Medicare patients for their brand name drugs, and in exchange, Medicare will cover a lot more. So it's basically that Medicare will cover more of the brand name drugs, but you need to lower the cost. So it was the same kind of deal that they made with the pharmaceuticals. And it also made the reason that the pharmaceuticals ended up being on board is that it made them look like the good guys. So they could do advertisements saying we lowered costs for Medicare patients and we support Obamacare. So that was kind of the win-win on their side. Then they made a deal with hospitals, basically saying we're going to be insuring a lot more people, so you're not going to get a lot of uninsured people showing up in hospitals. In exchange for that, you need to reduce your reimbursement rates. So that was the same kind of concept that they did with all three of the major industries. And what it came about, the saying at the time was, if you're not at the table, you're on the menu. So either you are if you don't strike a deal with and get involved with this bill, then you're going to be the villain of the entire healthcare debate. So, for example, insurance companies at first were very hesitant of this, but there was a huge public PR campaign that basically made the insurance companies the villain of healthcare. Basically, they're the ones that are rising costs and everything. So to switch that, they had to kind of get involved. So it was kind of a carrot and stick approach to get them involved. So after the industries were on board, a lot of the congressmen went back for the August recess and found an enormous amount of protest and opposition. And there was a lot of people hated the public option, and they hated what they considered the death panels, which I'll talk about what exactly death panels are in a second. And it's also the summer that Senator Kennedy died, and he was really the patriarch of healthcare. So it was kind of symbolic at the time. And that's when the Democrats pretty much gave up on bipartisanship. In the beginning, Obama said, I want to get as much bipartisanship support for this because that's the only way it's going to be long-lasting and everything like that. But by this summer, the Democrats realized that it wasn't going to happen. So by November, they get back into Congress, and they had to get enough Democrats on board with the bill. And that proved to be a lot more challenging than anyone thought. So Speaker Pelosi literally had to go door by door and asking people to vote for this bill in exchange for some sort of favor. So that's why there's all these little provisions in the bill that don't seem to make sense. And that was basically some little program. So some congressmen will say, I'll support this bill if you decrease premiums on this insurance company in West Virginia. So that's where there's these little provisions in it as well. And what came to be a very divisive issue, which almost killed the bill completely, was the abortion issue. And it wasn't necessarily supposed to be such a big issue in the beginning. Obviously, it did end up being a very big sticking point. Because the Democrats were very close to the amount of votes that they needed, every single vote counted. And there were a lot of pro-life Democrats that were not willing to vote for a bill that included any sort of public funding for abortion or abortion insurance. So this was Nancy Pelosi was in a very difficult position because she herself was very pro-choice, and she was the first female as the Speaker of the House, and she had a lot of females and just pro-life, pro-choice Democrats in her Congress, in her party, but she wasn't able to get enough Democrats on board that would support it with this this federal funding for abortion. So it ended up being there's actually a story that she had some Catholic bishops in one room and the head of Planned Parenthood in the other, and she was just running back and forth trying to negotiate something to get both sides happy, and it just wasn't going to happen. So it ended up passing in November of 2009 in the House, and there's actually harsher regulations against abortion funding than there were before. And so a lot of Democrats that supported it, or pro-choice Democrats, were very disappointed as well. So that's also something that's gonna get worked out in the future. In the Senate, very similar things happened with getting to the votes. There were about 59. Senator Lieberman was the 60th vote that the Senate needed to pass the healthcare bill in the Senate, and he used that power a lot. So since he was very critical, and he knew he was very critical, he went on TV saying, "I'm only going to vote for it if there's no public option," and that pretty much killed the public option right there because his vote was so critical. And so PR played an enormous role, and during this time, if it was on TV, it was reality at that point. So everything that was said really just became, since it was such a sensitive issue, whatever was said at something in the morning, by night it had already happened. So he played a large role as well. Eventually he did say yes when the public option was killed. And the Senate passed it on Christmas Eve in 2009. I don't know if maybe some of you guys remember that. So January comes around, and now Senator Brown in Massachusetts won Kennedy's old spot in the Senate in Massachusetts. And some people say that Senator Brown won because Massachusetts already had universal health care and they already had health care reform, that Massachusetts didn't necessarily need Obamacare because it would be more of a burden on Massachusetts when they didn't really need it. So that was kind of the ironic side of that campaign, because Massachusetts was such a pro-health reform state. It's a very blue state. So that was just something interesting about that. But they lost the supermajority, so Pelosi in the House had to pass the Senate bill, whatever, very technical. It ended up almost dying many times during Snowmageddon, and it pretty much had died for a week since the momentum was gone. But then that's when they were like, all right, it's time to call in the reserves. Let's get Obama in there. And he started campaigning very hard for what then became named Obamacare. And he became the spokesman and kind of the face of it. And that's really what pushed it to the end. And it passed on, it was in March of 2010. It passed 219 to 212. Not one Republican voted for it, so it ended up being very strictly on party lines. And during this entire healthcare debate, there was over $1 billion spent on lobbying and advertising. And people didn't really like all of the backhand deals, as they called it. They were hoping that during the Obama administration, he kind of ran on this platform that he was not really an insider into Washington. It ended up being a very Washington stereotypical kind of bill. And there was a lot of disappointment in that. There were a lot of roadblocks along the way. Abortion, as I said, the individual mandate that I'll talk about in a second. All the insurance companies, pharmaceuticals, special interests, the public option was a huge issue. Death panels and all the deals with every single representative. And there was enormous opposition, which I'm sure you're well aware of. The biggest reason I think that there is enormous opposition is people don't really know who the winners and losers are. So some people nobody really knows how it's going to benefit them and how it's going to hurt them. So there's just, as I said before, just a lot of confusion, and that really raised a lot of this opposition of just so much was done behind the scenes that it was hard to tell. And we're still figuring out, we're still kind of teasing out what's in the bill. That's because it was 2,700 pages long, it's 450 provisions, so I guarantee no one's read it. Maybe one congressman's actually read the entire bill. But the goal of the entire bill was basically to get as many people insured as possible, was to really cover this insurance gap that we have in our country of about 50 million people uninsured, and raise 32 million new people that would have insurance after Obamacare is completely implemented. The reason why uninsured was such a big issue was that 43 billion of uncompensated costs come from the uninsured. So that's people that are uninsured that are using emergency rooms as their insurance, showing up to emergency rooms because they don't have to pay for it when they have a heart attack or whatever, or just come in for routine care. And that's all paid for by taxes and by higher premiums for everyone else. So it was really to get those people insured, to bring down those costs. It's called the Patient Protection Affordable Care Act. It didn't really address costs as much. It didn't really bring down costs because it would have never passed. It was way too political, and nobody wanted to. It's also, as I said in the last one, it's an economy. It's its own industry. The healthcare industry makes a lot of money, so nobody really wanted to address costs. It was based primarily on the Massachusetts model, which I'll talk about in a second. And it might not feel like anything's really happened because all the big things are happening in 2014. So just going back to the uninsured rates, 18% of the country before Obamacare was uninsured, and it was primarily the southern states that have the highest rates of uninsurance. And usually people think you're uninsured if you're unemployed or something. When they do the statistics, actually most people have one or more full-time workers in the house, but either they're self-employed or they work for a small company that doesn't provide insurance. And a lot of people aren't just super poor. There's a large amount that are between 100 and 250% of the poverty level that also don't have insurance. And another big group that is not insured primarily is this, what we call the young invincibles, which is 18 through 34, 19 through 34, people that don't feel like they'll never get sick, they'll never need to go to the hospital, they never use it, why should they pay for it? So it was to get those three groups really to get the most insurance. And as I said before, 30% goes to hospital care, and that was really the major issue, to getting all the uninsured people out of hospitals. So this is before, this was if there was no health reform, and if there are. So by 2022, there'll be double the amount of insured people than there would have been without it. So it really does tackle insurance as much as possible. So the Massachusetts model. It was called Romney Care. It passed in 2006 in Massachusetts, and it was basically the same thing as Obamacare. They would have these exchanges, which they called the Commonwealth Connectors, which basically brought individuals, and I'll talk about this later, but it brought individuals to private health insurance, and it regulated that exchange. And everyone had to buy insurance. It was a mandate. It still is. I'm from Massachusetts. Everyone has insurance. And you pay a penalty if you don't buy insurance. And it's the same thing as Obamacare. It also expanded Mass Health, which is their Medicaid program. And it aimed to cover 95% of people in 3 years, and it did that almost. And right now, they're trying to introduce some of the price controls, which is a very sensitive issue, is really just bringing the prices down. So we'll see how that goes. This was an interesting quote because Governor Romney was in the news a lot, obviously, recently. Some of my libertarian friends balk at what looks like an individual mandate, but remember, somebody has to pay for the health care that must by law be provided. Either the individuals pay or the taxpayers pay. A free ride on the government is not libertarian. So that was his argument for why he needed to pass Romney Care. Some people, he argued that it wouldn't work in the rest of the country, and I think one of the reasons why he thought that was that Massachusetts is a very blue state, and they're very used to having a large government role. And it was looked at as more like, the seatbelt laws, the seatbelt commercials, buckle up for your safety. It was seen they did a huge PR campaign of buy insurance for your safety. It was more of like a kind of a public awareness rather than buy insurance or else you're going to get fined, or buy insurance or else you're going to get taxed. So that's how they kind of spun it, and people have been generally happy with it. And actually, I think I said this last time, but hospitals in Massachusetts are actually losing a lot of money right now because so many people are getting taken out of emergency rooms and going to private practices, which are much cheaper. So hospitals are kind of worried that their admission rates are much lower and they don't really know what to do with that. So it's been successful. All right, so I'll go through the major changes in the bill. The major one is Medicaid expansion, the insurance reforms, the exchanges, individual mandate, and then lots of other provisions. So Medicaid expansion, I talked about Medicaid last time, but Medicaid is basically low income, what we would consider the socialized medicine of the welfare state, I guess. It's everyone under, it used to be every state runs it differently, so it's 50 different programs, and the state decides who's eligible. This basically changed it that everyone under 133% of the federal poverty level is eligible. And that's about $30,000 for a family of 4, and it's about $15,000 for an individual, is about 133%. And it's difficult, and I think I talk about this in the next one, but it's difficult for poorer states because they have a lot more people that are under that federal poverty level, so there's more people on Medicaid, and so it does become a burden on the state. But the federal government pays about 70% of that bill for the state Medicaid programs, and the states pitch in the rest of it. So all the newly eligible people will now be covered by the federal government, and that's about 15 million new people will be on Medicaid. The states don't need to accept it, but then they won't get the funding for it. So it's kind of a, again, kind of a carrot and stick approach. So these were the different eligibility levels for the most part of who would get Medicaid, and now they're just cutting it so it's 133% no matter who you are. So pros and cons to the Medicaid expansion. The lowest income people will have access to basic care. It's supposed to have a larger impact on kind of preventative care and keeping people out of emergency rooms. And it's supposed to save money in the long term. That's been debated. Nobody knows for sure. And the biggest thing is also that federal dollars are going to be flooding into the state. So that's kind of where the job creation comes from, is getting a ton of federal dollars to set up new hospitals and doctors and everything. The cons are states are very worried about the cost. Even the small percentage that they have to pitch in is a large percentage of their budget, especially the poorest states, which are going to have an enormous amount of people on Medicaid. They're also worried that it's just going to flood the system, that there's just not enough doctors that accept Medicaid, there's not enough hospitals, there's just not enough infrastructure to take in this enormous amount of new patients. They're worried about long waiting lines and everything like that. And it's also just very politically unpopular in mostly conservative states. So it's a huge entitlement expansion. So they have to kind of sell that. A lot of the more conservative states have to sell that to their constituents. And so not a lot of states so far have accepted it. The blue ones are the ones that have accepted it, and then other ones are kind of deciding. It doesn't start till 2014, so that's kind of in the process. But all the red states are the ones that said that they're not going to participate. And there's been a lot of lawsuits from the states to the federal government suing over a lot of the issues involved with that, and I can talk about that later. So the second big change in the bill were the new rules for insurers. So as I said before, the deal was that insurance companies got a ton of new customers in exchange for lower premiums and a lot of new regulations against them. And some of those new regulations I'm sure you've heard of. They're not allowed to deny for pre-existing conditions anymore. There's limits on rating factors. So before, if you had diabetes, they could charge you 10 times more than they would charge anyone else. Now they can't do that. The only thing they can rate you higher on is your age and if you're a smoker. And there's no lifetime limit, so if you use up all your benefits, you're not just out of luck after that. And they can never they can never take your coverage away. There's also caps on how much the premiums can increase every year. And also, I'm sure a lot of you guys have heard of this, that young adults can stay on their parents' plan until 26, and that was to get those young invincibles to have insurance. And they're also a huge source of revenue because they have insurance, they're cheap, but they don't really use it as much as the older and sicker people do. A couple other things, but also that preventative care will also be free under all coverage plans, or under any new plans. As a lot of people say that the individual mandate is what is necessary to keep this whole thing sound. So having a lot of people forced to buy private insurance will make the pool bigger and then bring all the costs down. The CBO predicts that premiums will decrease by 3% by 2016. That's debatable. There's lots of different variables. Everyone has different projections, but that's what the CBO put out. They do save a lot of money on bureaucracy now because there's huge amounts of people and huge amounts of bureaucracy of going through and denying claims and deciding who is going through everyone's medical records to say you don't qualify for this, you don't qualify for that, and denying everything. So without all of that, that will save a lot on admin costs. But some people say that it could also increase premiums because you're going to have a lot of more sick people that have insurance as well. So it's kind of up in the air to see how well that works out. The other big change in in Obamacare is this idea of these exchanges. And I don't know if you guys heard of this concept, kind of, sort of. Basically, what it's doing is taking, if you're an individual and you're trying to buy insurance on your own, it's extremely expensive before you could get denied, and there's no real financial incentive for the insurance company to take you because you might have a pre-existing condition, or you're buying insurance because you're going to use it. So there's no power for the individual to be able to buy insurance. So what these new exchanges do, and these are going to be at the state level, is basically pooling together groups of uninsured people and saying, okay, Aetna, Cigna, Blue Cross Blue Shield, how much are you willing to pay for 20,000 new customers or 30,000 new customers? And so they have to bid on these groups of individuals. So that's really the concept behind these exchanges. And And it's supposed to, and then people that can't afford it, or like depending on your income level, then you'll get a government subsidy to be able to buy the private insurance. So that's the way to get everyone on all income levels to be able to afford insurance. So they'll receive tax credits for that, and they also have to cover all the, it's going to be very regulated, it's highly regulated, so the insurance companies that participate in the exchanges, they have to cover for a certain amount of preventative measures and kind of these essential benefits. They have to provide preventative care, they can't deny pre-existing conditions, that kind of stuff. There's also, there's multiple different levels of coverage that you can choose from, and they're also experimenting with a new catastrophic plan for everyone under 30 that can buy into that, which is basically just anything over $5,000 a year that they pay for. They're doing the same thing with small businesses. So there's the individuals exchange and then there's small business exchange. And the small businesses is basically the same thing happens with small businesses when they try to buy insurance. So if you own a small business of 10 people, it's very expensive for you to buy insurance and to pay for it. And that was really crippling a lot of these small businesses. So for example, this is for a large corporation, but former Chrysler president Lee Iacocca said that U.S. automakers spend more per car on healthcare than they do on steel. So that shows how, and that's for an enormous company. For a small company, it's much more expensive. So basically what they did is that anyone over 50, if you own a company and you have over 50 employees, you pay a tax if you don't provide insurance. But if you do provide insurance, then you'll get a subsidy. So it's a huge carrot and stick approach. So anyone under 25 employees, you'll get a subsidy for your employees to go buy insurance on the exchanges. And you can have them go through the exchanges themselves, and then you pay their premium. So there's different ways of doing it, but if a lot of small businesses, if they don't provide it, then they're going to have to pay a tax. They don't know how successful that's been because the tax is $2,000 per person, and it's actually cheaper for for small businesses to pay the tax than it is to pay for the health care. But it is a benefit that a lot of companies do provide. So it's up in the air to see how effective that will be. So this is basically the idea of the exchange. Of course, you're not going to be shopping. You can buy insurance online through the exchanges. But the idea is that individuals and small businesses go and they see what their income levels are and what they're eligible for, and they get a voucher of how much money they can spend, or depending on their income levels, what percentage of the premiums that the government will give them. And they go and shop for insurance, and they'll have Aetna, Cigna, Blue Cross Blue Shield, a certain amount. And it's going to be, the states will decide which insurance companies will be in the exchanges and which won't. So this is a little diagram I drew. I hope this kind of helps explain it as well. But it's basically pooling people together, and some people the green people will receive a subsidy. So the insurance companies don't see who has low income or not. They just get all of the money from it. So that was kind of the deal that was struck to get as many people to have private insurance. And these companies have to basically compete to get as many people into their system. And this is kind of an overview of how, in the ideal, what the idea was behind all of these provisions was to get everyone covered. So everyone up to $30,000 for a family of 4, everyone who makes that much, or $15,000 for an individual, will have state Medicaid. Anyone from $30,000 to $92,000 for a family of 4 will go to the exchange, if they're uninsured, will go to the exchanges and they'll get a subsidy depending on their income level. And anyone who makes more than that can also go to the exchanges, they just won't get a subsidy. So this is the ideal. There's a ton of problems with it, and kind of the implementation of that, it's been very difficult. But that was kind of the idea behind it. So arguments for and against the exchanges: more uninsured people get coverage. That's a pro. Private companies can compete for those contracts, so all the money is going to private industry. There's no public option, so the only public money goes towards private insurance. It protects the consumer from a lot of these regulations that weren't really working well in the healthcare industry before. It helps small businesses stay competitive, so they can still be able to provide benefits for their employees. And consumers can still choose the coverage that they want. They still can use private insurance. They can pick which plan that they want. The cons are that small businesses might still not be able to afford it. Federal and the state governments are going to be controlling private industry, so a lot of people are worried about that as well. The states might not be able to afford some of the subsidies that they have to pay out to their constituents. And there's going to be a lot of federal tax dollars that are going to be spent on this. So it's kind of, where is that money coming from? So the fourth big change is this idea of the individual mandate. And I know a lot of people, everyone's probably heard of this. A lot of people think it's the glue that kind of holds it all together. And it's basically this idea that everyone, if you're a citizen, you have to have health insurance. And it has to be qualified health insurance, either through your employer, Medicare, Medicaid, or private insurance through the exchanges. And the idea is that without it, then only sick people, if there's no denying for pre-existing conditions, there's nothing stopping someone from never having an insurance until all of a sudden they get cancer and then they want insurance, because there's no denying for pre-existing conditions. So the idea was to get everyone to be covered, so that takes out that entire equation. So the young and healthy people now will pay into the system, so when they do need it, they'll be able to get those services as well. And to stop this adverse selection. And not all groups have to buy into it. So if there's a if you religiously oppose to it, or I think for kind of Native Americans, they don't have to buy into it as well. And there's a couple other provisions. If you choose not to buy insurance, either through the exchanges or any way, then there's a penalty of about $700 a year, and that's taken out in taxes.
Is that per person?
Per person, yeah. And for a family, I think it's $2,000 or something. I forget. And that's not going to go into effect, I think, until 2016 or 2014. I forget. Of course, it's very controversial. I'm sure you guys have all heard of that. There's been the argument that it's kind of like car insurance, because if you drive a car, you have to have car insurance. But the argument against that is that you don't have to have a car, whereas everyone will have to have insurance. There's no opting out of that. The difference between car insurance and the individual mandate in health insurance is that you're going to use it, whereas car insurance, you might never use it, and you might pay higher premiums than you will ever get benefits. Whereas with health insurance, you're buying it because you are going to use it sometime in your life in some form. And it's really to stop a lot of this free riding problem of people that don't have insurance showing up to emergency rooms. So that was kind of the reasoning behind it, is to make sure everyone pays for care in some way. So arguments for and against. As I said, you will use the healthcare system at some point. More people will be insured, which will bring everyone's premiums down, ideally, because risk is spread more evenly. It's also necessary, some people argue, for other aspects of the bill to work, and it, as I said, stops the free riders. The cons are that people, if you're healthy and you never go to the doctor, that's too bad. You still have to buy insurance, and you still have to pay the premiums. Even though it might be cheaper just to pay out of pocket. So some people might actually elect to pay $700 in taxes rather than buy insurance, because it might be cheaper. And of course, the major con is this idea of these individual freedoms. Can you actually force someone to buy a private product? So a couple other provisions that didn't really make the news as much. A lot of cuts. Well, I guess this one did. Medicare got cut pretty deeply. 500 billion cuts over the next 10 years. The more you make and you're on Medicare, you're going to pay more. There's no death panels. Death panels were basically this idea that if you're a doctor and a Medicare patient comes to you and you give them end-of-life consulting, so kind of what their options are, that you'll get, as a doctor, you'll get reimbursed for that hour. Right now, doctors will talk to Medicare patients and tell them what their end-of-life decisions are, but they don't get reimbursed for that hour, whereas this is basically just paying them for that hour. And the argument against this idea of death panels was that people thought that doctors, since they're getting paid for it, would rather tell people, you should just not take this treatment, you should just die, because it's cheaper for us. So that was the idea of the death panels. And also about cost effectiveness analysis, which is if there's two treatments and one is a lot cheaper than the other, but it might not lead to better outcomes, is Medicare allowed to choose between those two, or should we just pay for whatever people want? None of that's happened, so that was completely taken out of the bill. But they are experimenting with new payment methods. Another major part of the bill is a huge push towards prevention. I think Tony and I were just talking about this. A lot of preventative services are now free, and primary care physicians, which are a lot cheaper than specialists, are going to be getting larger bonuses, and there's going to be a lot more incentives to become a primary care physician. Nurses and PAs are also going to be making more. There's more federal and state funding for wellness programs there's tax advantages if you give some sort of gym membership to your employees and those kind of things for businesses. Fast food companies have to show their nutrition labels. There's also, in the future, there might be premium discounts if you're healthy. But they're still working out what's considered healthy if you've lost weight in the last year, but what if you had a baby or something like that. So they're trying to work all that stuff out. A lot of screenings are now going to be free. Some people are worried about that because a lot of screenings aren't necessarily better. There's been an issue, I think I talked about this last time, where mammograms might be leading to more breast cancer because of all the radiation. So screenings aren't necessarily better, but that is something that a lot of people wanted. This was an interesting way of looking at it. One of the arguments I saw was that, is it really cheaper to give more preventative care because that keeps people alive longer and then we're going to be spending more? So I guess is kind of a catch-22 of how you want to spend it. So that's another argument. It's kind of, if people are living longer, then it's going to cost more. So just throw that out there. Another major emphasis was on quality and kind of rewarding doctors for quality instead of quantity, which was kind of the rewarding system of the fee-for-service under Medicare for the last 50 years. Also, doctors are going to change in the next, I'd predict, 20 to 30 years of how medicine is practiced. The future is going to be much more coordinated care, more investment into information technology and kind of these electronic records, and it's going to be more team-based. So they're experimenting now with this patient-centered medical homes, which is basically you go to this medical home and there's every single type of specialist and every single type of doctor, and they have a case manager and they're in charge of that person and they send you. So it's basically just better coordinated care. That's supposed to save money. For example, a Medicare patient sees about 7 doctors a year, and most of them are specialists. And the problem is that there's just no coordination between them. So your records for your dermatologist might be over here, but he doesn't know about your cardiologist's records. And so there's just a lot just not talking to each other. And in Massachusetts, 70% of doctors actually like this better. And tort reform, which was more the defensive medicine and a lot of the medical malpractice, that didn't pass in Obamacare. So that's still an issue that's getting worked out. So how are we going to pay for this? It's supposed to cost, and a lot of these estimates, nobody really knows for sure because it's actuaries working on crunching numbers and doing projections. But since we're talking about people, nobody really knows exactly what the numbers are going to be. But the prediction from the Congressional Budget Office was that Obamacare is going to cost about $938 billion over 10 years, and it's supposed to save $1 trillion. So that extra $1.35 billion is supposed to bring down the deficit. That's what the argument's for. It's very hard to predict because we don't really know how much it's really going to cost and how much it's really going to save, because savings here might end up leading to costs there and vice versa. Another way that they're raising money is that everyone over $200,000, everyone who makes over $200,000 a year pays an extra 1.5% towards Medicare, and same with $200,000 a year if you make that on your investment. So that's the capital gains tax. There's also been a lot of industry fees and cuts to their reimbursement levels that I talked about before. That was part of the deal. Medicare is getting cut pretty deeply. And then other little things like taxes on tanning salons and those kind of things. And there's also, they're going to raise a lot of revenue for this tax from not buying insurance to see how many people actually end up paying that tax. So this I tried to find online and I couldn't, but this is basically kind of the where's the money coming from, where's it going. So that's where, cuts to Medicare, increases on the high-income taxpayers. Oh, it's only going to actually affect 2% of taxpayers. I remember during the campaigns when Obama kept saying over and over, we're just going to make the top 2% pay a little bit more, so everyone else, that's what he was talking about with this. And then other penalties and provisions. And that's going to pay for the subsidies for the exchanges and also Medicaid and CHIP, and then some other things. And then it's supposed to save $143 billion towards the deficit. We'll see if that happens. Just moving on to the Supreme Court issues. I know I'm kind of running low on time, but basically the three main issues in the Supreme Court was this idea of, is the individual mandate unconstitutional? And they ruled that it was constitutional because inactivity is equal to activity. So you can tax someone for doing something, and then you can also tax someone for not doing something. And that was the ruling that they came up with. And that the federal government has the right to tax, and they have the right to do what's necessary and proper, and the spending clause and all that stuff. So they have a right to tax interstate commerce, and they said that people that are not buying insurance are actually affecting interstate commerce. So that was kind of the way around that. The second one was, is the federal government coercing states into expanding Medicaid? Is the government putting too much pressure on the states and really overextending its power? And the ruling was yes and no on this, was basically that it is okay for the federal government to have the states do the Medicaid expansion, but they can't take away the funds that they already have, because that was what they were doing before. It was basically saying, expand Medicaid and we're not giving you anything, whereas now it's expand Medicaid and we'll give you more, but we're not going to take away what you already have. And then the third one is, if the individual mandate is unconstitutional and that's supposed to hold it all together, will the whole thing be thrown out? Since the individual mandate is constitutional, then that wasn't really an issue. It was passed in June. I'm sure you guys all remember seeing the paper when CNN said the wrong thing or the first 10 minutes and then switched their decision. Chief Justice Roberts, who's a conservative, was kind of the deciding vote on this, and it was voted 5-4 that it is constitutional, the entire thing, in all three. However, people still don't know how they feel about the Accountable Care Act. And this kind of shows people that are favorable and unfavorable or just don't know. And it's kind of been pretty consistent the entire time. And people there's no swing one way or the other. It's very politically aligned, and people have very strong opinions either way. So what were the major reasons why people are against the health care reform? Some people say that it's giving the government too big of a role. Too much of it was just these shady deals behind closed doors that people didn't like. They think it's too expensive to pay for right now. It takes the wrong approach. Some people said the opposite, that it didn't go far enough to control costs. So that's some of the arguments against it. Some of the GOP alternatives to healthcare reform was this idea of a voucher system for Medicare, which is basically having Medicare patients, so anyone over 65, they're going to just get money to go buy insurance on the private market. So it's basically a Medicare exchange. And they also are arguing for more health savings accounts, which some of you might have these flex spending accounts, health savings accounts, which is basically you put in $5,000 a year, and if you use it, great. If you don't, it rolls over to the next year. So it's kind of putting it more into the individual's pocket. No, it doesn't. No. You lose it? No, it's flex spending accounts that rolls over. Yeah. Sorry. Flex spending you lose? Okay, sorry. And they were going to keep these high-risk pools so this pre-existing condition thing was going to go away either way. And there was never going to be taxpayer funding for abortions. And it was basically a lot of it, we're going to just go back to kind of the way things were. So no exchanges, no Medicaid expansion, no individual mandate. But this was some of this was a lot that I found from different blogs and everything, and some from what Romney said and what Ryan said. But there didn't seem to be one kind of united front, and there isn't on either side of one way of doing things. So these were just some of the ideas that were talked about. So some of the major issues going forward is, how do you get the states to accept the Medicaid expansion, or should they accept it? And will it really just overwhelm the system? Is it just too much for the states? And we'll see what happens with that. Just implementing this entire thing by 2014 is just an enormous challenge for the states right now. And also just how much of these incentives, both penalties and subsidies, is it enough to really change behavior? Or are people just going to go to whatever is cheapest? So that's a lot, is just kind of wait and see. We'll see how effective these things are. There's still controversy over death panels and abortion. And the big thing is that it didn't really address costs, so that's going to be an issue down the road of how to control costs. And people don't know if it's going to end up saving money or costing more. So people argue both ways, and the difficult thing is that if you prevent something from happening, you don't really know if that's going to end up saving money or not. So that's kind of why a lot of these numbers, nothing's really set in stone. So a couple resources that I thought would be helpful. If anyone's seen that I got some of this stuff from, if you go to healthcare.gov/law, they have a lot of the major issues. Kaiser Family Foundation has a lot of good resources. There's a documentary called Obama's Deal that talks about kind of why this, more like the historical side of it. There's also this book that I would really recommend. It's called Landmark, America's New Healthcare Law and What It Means for Us All. It kind of tells it as a story. It's a kind of easy read, and then it gets really policy-based at the end, so it might be boring for most of you. But there's also, if you're looking for things that are more specific to your own needs, Washington Post put out this kind of, I don't know, like a survey or something where it's kind of like a flow chart to see what you're going to get out of it. So if you have health insurance, how many people in your home, what's your adjusted income, and it asks you all these questions, and it tells you at the end how it affects you individually. And the same thing for this at New York Times had something similar where you say, are you insured, uninsured, how are you insured, and then it tells you how it affects you. And then if you're also looking for a kind of a quick, fun video, Kaiser Family Foundation put out this 9-minute video, which is with cartoons, and it basically explains the entire healthcare reform. Thank you.